You're listening to Upgrade Your Health and Wellbeing podcast. Take care of your health and change your habits for the better.
Welcome to another podcast.
Upgrade your health and well-being.
And today we'll be talking about two diseases.
Do you have friends or relatives that truly believe they are sick and visit a plethora of doctors, one after another? Or do you have a relative or a friend that is pretending to have certain diseases, fabricating certain diseases, and becomes the subject of many medical specialties? If so, this episode is for you.
This is a very big problem, not only for doctors, but also for the healthcare system, because these patients, as I understand it, circulate between primary care physicians and specialists.
Yeah, very much so. I've just started talking about two different medical entities. The first one being hypochondria, which is defined as the condition in which a person truly believes they are sick, and therefore the person seeks medical attention. Whereas the second condition, labeled as the Munchausen Syndrome, is related to the situation when the person fabricates a particular symptom or a set of symptoms to draw attention.
The fact that we want to be exceptional and draw attention to ourselves also applies to situations where social media is so very important. Does this affect the development of the disease?
Definitely, it does have a great impact on that, right? Patients with Munchausen syndrome, currently known as fictitious disorder imposed on self, fabricate medical history, lie about symptoms, manipulate laboratory tests, and also induce illness, for instance, infect wounds, take drugs to produce symptoms. They also seek frequent hospital admissions by moving between hospitals. It's difficult to establish the prevalence of fictitious disorder imposed on self. However, in case of patients with hypochondria, the prevalence ranges from 1 to 1.3, 1.4 of the general population. Sometimes the data are higher in terms of percentage. As regards the symptoms of hypochondria, currently known as illness anxiety disorder, the following are of common occurrence: persistent preoccupation with having or acquiring a serious illness, minimal or absent somatic symptoms, excessive health-related anxiety, disproportionate concern about normal bodily sensations, failure of medical reassurance or negative tests to elevate concerns, frequent self-examination or checking for signs of illness, excessive health-related research, for instance, internet searches, avoidance of situations or activities perceived as health risks, and significant impairment in daily functioning due to health anxiety.
How can this disease be diagnosed?
Well, first of all, a doctor should pay attention to several factors. Whether the patient is talking about hypochondria, whether the patient really presents certain symptoms, or generally he is so obsessed with certain diseases, such as cancer, for instance, or any oncology-related condition, that this worry takes control of his or her life. Therefore, the person is preoccupied, completely preoccupied, and focuses all their attention on this very condition. If so, then obviously that should be discussed with the patient, because unfortunately a lot of patients are even unaware that they present with the symptoms that are typical of hypochondria as such.
Can hypochondria be treated?
Of course, in terms of treatment of these two conditions, there are different approaches. First of all, talking about hypochondria, there are two ways of dealing with the condition. The very first being obviously psychotherapy, this is the first line, and pharmacology as such. Talking about pharmacological approach, we take into consideration selective serotonin reuptake inhibitors, these being mainly sertraline or fluoxetine, and they are very effective, provided that the patient wants to cooperate. So when we talk about the disease, adherence to treatment or compliance is of crucial importance. And the prognosis is quite good compared to the prognosis associated with the Munchausen syndrome, because we need to remember then during this psychiatric condition, some patients are not willing to cooperate. They further escalate the symptoms, exaggerate, and they do not want to undergo certain treatment. Psychology is of crucial importance in here. Pharmacology also, when the patient presents with certain mood swings, depression, and so on and so forth. But definitely this condition is very difficult to treat. First of all, because the patients as a group or a patient as an individual has very in-depth knowledge of medical matters. They know exactly about certain medical conditions. Therefore, they sometimes even lie to doctors so well that they are unable to differentiate the truth from the myth as such.
Besides the fact that patients circulate between doctors, is there some other problem that can occur in the office with a patient with these two ailments?
It depends. Talking about the Munchausen syndrome, we need to consider a couple of factors. First of all, these are the individuals that may present with certain conditions, certain other conditions, these being, for instance, personality disorders, depression, trauma history, or impulse control issues, right? So the task of the physician is to diagnose the condition and indicate and manage further treatment.
And what is Munchausen by proxy?
Okay, we have two forms of Munchausen syndrome. Munchausen as such versus Munchausen by proxy. Munchausen as such is characterized by having or provoking certain symptoms in oneself. So the person fabricates certain symptoms in themselves. Whereas Munchausen by proxy is associated with the situation where, for instance, a mother or father fabricates the conditions of another person, for instance, of a child, by adding, for instance, some blood to the urine samples and so on and so forth. So to attract the attention of the medical specialist, for instance, right? Of course, it's a pathological situation that can be very dangerous because based on the literature, there are certain cases that resulted in death, obviously, when the patient was treated. That treatment was not necessary, and due to, for instance, anaphylactic reaction or too much management or excessive management, unfortunately, certain adverse effects occurred in a person.
Is there some way to prevention, maybe against this disease?
Both are psychiatric disorders, and from this perspective, people need to be very vigilant. The most significant factor is the attention that the physician needs to pay as far as a particular person is concerned, because we need to know, and I'd like to stress it one more time, that patients that present with the Munchausen syndrome are those that have a very detailed knowledge of medicine. Therefore, their medical background or medical knowledge is sometimes equivalent to the knowledge of a physician in certain respects. So awareness of the clinician, of the physician, is of utmost importance. One more thing that we need to focus on is the fact that if both conditions, namely hypochondria and the Munchausen syndrome, are not treated, the consequences may be devastating.
Then what might the consequences be?
Of course, starting with the Munchausen syndrome, the first thing that comes to my mind is obviously self-harm, right? And harm to the others, like their children and so on, that ultimately may result in these people's death. This is the first thing. In terms of hypochondria, obviously certain things that make it impossible for the person to cooperate or to have a good quality of life, because the person is bombarded with certain factors, and therefore their quality of life decreases. There can be even overlapping of certain other complaints. For instance, obsessive compulsive disorders. So when the person presents with obsessive compulsive attitude and tries to find out what a particular condition he should be diagnosed with.
So we see what a big problem these types of disorders can be, not only in an aesthetic medicine office, but above all in a family doctor's office.
To conclude, patients that present with hypochondria or the Munchausen syndrome may be our friends, maybe our co-workers, maybe our fellows, or even family members. We should be aware of the situation, and we should act accordingly, bearing in mind that the quality of life is the most important factor in our life as such. Thank you for your attention.
Thank you very much.
Upgrade your health and well-being podcast. Take care of your health and change your habits for the better.